Hi, everyone. My name is Sara Skonieczny. I'm the Clinical Youth Specialist for the City of Somerville in the Department of Health and Human Services. I'm also the manager of the city's Trauma Response Network, which provides support following a traumatic event in the city. And I'm a licensed clinical social worker specializing in group work and trauma.
And I'm Vaughan. I'm the Substance Use Prevention Coordinator for the City of Somerville, also Department of Health and Human Services. I work at the Office of Prevention around substance use prevention and community education efforts in the city, especially with public schools. And I'm also a licensed therapist who focuses on addiction and trauma.
The last few months have been an incredibly challenging time for individuals of all ages. People are facing many difficult experiences, and many have lost access to their supports and their resources. It's been a particularly tough time for youth. Being a young person can be stressful under normal circumstances, but recent events have made things even harder for many. With schools being closed and events being canceled, many young people are missing out on big moments in their lives, as well as everyday moments like spending time with friends, going to school, and participating in favorite activities. Stress levels and emotions are running high, and we can sometimes forget that being a young person and not having adult privileges means you can't ask for help in the same way. We're here today to answer some questions about what young people can do to take care of their mental health and how adults can support them.
So what are some common responses or reactions that children or adolescents might be having during these stressful times?
So it's important to remember that children's responses will vary based on their developmental levels. Younger children may have fewer internal coping skills and often look to the adults in their lives to navigate during stressful times. Teens and adolescents are more independent and may have access to more supports outside of their home. Although these responses may look different depending on the age, children and adolescents can show responses that are very similar to adults. They can experience feelings of hopelessness and helplessness. They can be overwhelmed by strong emotions or feel like their emotions change really quickly. They can experience anxiety and worry about what's going to happen next or about their loved ones and their friends. They can feel angry or intense sadness about what's happened or the losses that they've experienced. And sometimes these emotions can build up and come out in unexpected ways. They can also feel lonely and isolated, being cut off from their social supports and connections. During challenging times, we also see young people struggle with their attention and their concentration. And this can really impact learning, especially with the need for them to be more independent around remote learning. There may be sleep and appetite changes, especially with the loss of routine. And sometimes children's attachment to the people in their homes becomes stronger, so they may have a challenging time separating or spending time away. We want to remember that whatever we're seeing with our young people during these stressful times, we want to meet it with compassion and with patience. These are hard times and a very abnormal situation. And I say this to both adults supporting and young people who are experiencing struggles. Please be gentle with yourself and to each other, and that you aren't alone in whatever you're experiencing.
So what are some steps that parents can take to support their children around their mental health and their self-care right now?
So one of the best ways that parents can support their children is by starting conversations, and that goes for all ages. It's important to allow space for your children to talk about their experiences, to identify the struggles that they're facing. It also allows parents the opportunity to provide accurate, age-appropriate information, to correct any misunderstandings, and to just validate the emotions that their children are feeling. Another way is by establishing a routine that includes time for work and for schoolwork, outdoor activities and exercise, rest and leisure, and making sure that kids are getting enough sleep, which is really important. During times of stress, we can find comfort in things that we can expect and control. And so having a routine really allows for this. And it also ensures that we're scheduling in transitions between work and home life and school and home life, because we've lost that spending so much time in one place. Parents can also support their children in helping to increase their connections with others outside of the home. Social distancing doesn't mean that we can't be social and connect, as long as it follows the guidelines and recommendations so that everyone's kept safe. It's a good time to explore other ways to do this and to encourage children to find healthy ways to connect with their peers and supports.
So keeping in mind that adolescents are more independent than maybe some other younger children, how can they take care of their mental health, especially during this time?
So one thing I've really been encouraging everyone to do, young people included, is to just feel your feelings. If you're anxious, you're sad, you're disappointed, you're angry, you're lonely, you're tired, you're frustrated or overwhelmed, you aren't alone. These are really valid responses to what's happening. And it can be helpful to find ways to process and express these emotions. You can journal, you can talk to a friend, you can create something, you can spend time with a pet or in nature. It's important to find ways to let these feelings out in healthy expressions. It can also be really helpful to practice mindfulness. So this can help people feel more present and grounded, so more in the moment. It helps strong emotions feel more manageable, and it helps us remember that this is just today, and I need to focus on what's in front of me right now. There's a variety of apps that you can download to increase your mindfulness skills, including Headspace and Calm, and they're also offering free content during this time. And if you're someone who is experiencing loneliness or feeling really cut off, or you feel like you need additional support, there are options that you can access here in Somerville and on a larger scale. Many supportive services around mental health are offering telehealth options, so you can speak with someone over the phone or in a video chat. And your primary care physician or your school counselor or a trusted adult can be a great place to start this process going. There's also many crisis hotlines available for young people that you can call or text to speak with a trained clinician, and we'll put some of those up at the end.
And what should we be doing around media exposure for children and adolescents right now?
So one thing we notice when people go through a stressful experience is that they often feel like they need to be plugged in all the time. So they may be constantly watching the news, checking social media, having alerts on their phone, or checking in with their various connections. We're waiting for more news. And the world we live in really encourages people to be on all the time. This feeling of needing to be plugged in often comes from wanting to restore safety. So we feel like if we just know what's coming, we can better prepare for it. But we often don't get the information that we need, or we get mixed messages or inaccurate information. And we find that our stress levels increase because we're triggered by what we're seeing, and we're not getting the information that we're actually looking for. So for parents, you want to make sure that you're limiting social media coverage or just media coverage for your children and offering them age-appropriate information. You also want to remember that children of all ages watch you. And so if you're plugged in all the time and being upset about what's going on, they're going to pick up on that. For teens and adolescents, it's also good for you to set boundaries and limits on how you're staying plugged in. It is healthy and it is a good thing to take a step back and to recharge so that you can take better care of yourself, your loved ones, and your larger community. We need to be able to replenish our internal resources, and it's hard to do if we don't come up for air every once in a while.
Mm.
So now we're going to switch more into talking about what we're seeing around substance use. And so why are we so worried about youth substance use during this time?
Well, especially since the shutdown started, we've noticed some increase in youth substance use, and that's mostly around marijuana, vaping, dabbing, and also alcohol. Now, especially with smoking marijuana or nicotine and e-cigarette products, we're worried about the impact of that smoke on teens' lungs. Smoking can lead to inflammation and also irritation in the lungs, which in turn can have a major impact on health. We are still trying to understand the full extent of how COVID-19 impacts the body, but we do know that lung inflammation is a major symptom of the coronavirus. So anything that we can do to decrease lung risk right now is super important, especially if the person in question has a medical history of lung issues like asthma or COPD. And we also just kind of are continuing to worry in general about how substances are impacting youth health. Early exposure to substances can have a major impact on brain development, and that in turn can impact mental health, memory, ability to focus, and also things like decision making and impulse control.
And so what is the connection between substance use and mental health?
I'd say it's a pretty strong one. Now, every person, whether you're a youth or an adult, uses substances for a different reason, including some medical ones. So our concern is for the youth who are using substances as a coping skill, and that could be for loneliness, boredom, isolation, depression, anger, and also especially anxiety and trauma. The past 3 months have been very traumatic for our youth, and substances are often a way people try to cope with stress. And unfortunately, substances not only have the potential to be addictive, but they also have a lot of consequences attached to them. We talked a bit in the last question about medical consequences, but there are also a lot of emotional, mental, and behavioral consequences. And for people who are struggling with substance use, this can range from negative impacts on relationships with friends, family, your significant other, to impacts on your finances, your work performance, your school performance. There can also be a real worsening in other medical and mental health diagnoses depending on the substance in question.
So what are some coping skills that youth can use during this time to stop or decrease their substance use?
Well, you went over quite a lot of really, really amazing ones, Sarah, but I would say for substance use in particular, the biggest coping skill that I could possibly recommend to people right now during the shutdown would be for youth and adults, really, to remain connected with people who you trust. And that could be a parent, a friend, a support group, your therapist, a teacher or school counselor, a member of the clergy, anyone who can really listen and hear what's going on in your life. The more isolated we feel, the more often we find ourselves struggling with substances alone, and that's never helpful. And we also recommend that youth focus on doing things to reduce the symptoms that especially come with stress and depression. And this doesn't necessarily have to be therapy, but even just doing something like taking a hot shower or spending time doing a hobby, just doing something positive and productive can make you feel like you're a little bit more in control. And it also can help you to really stay focused in the moment and passing through that emotional moment and coming out on the other side of it without having to pick up. If you are the parent of a youth listening to this and you're worried that your child is using, or you know for a fact that they're using, we also want you to keep in mind that you want to educate yourself and also your child about the consequences of using. But keep in mind that scare tactics, whether it's during the shutdown or not during the shutdown, they just really don't work. Keep it simple, be honest, be open, and just really emphasize the fact that you just want your youth to be safe. Listen to them and what they have to say first, and then carry on the rest of the conversation from there.
So knowing that there are some restrictions, what resources are still available during the shutdown?
So we've listed quite a few things that you can do at home, but sometimes you just might need some more help. And that covers a wide range of things. If you think your child has consumed something like an opiate and they're starting to show symptoms of overdosing or they need medical help, obviously still please call 911 immediately. And you can also contact the Massachusetts State Helpline, which is a helpline dedicated to substance use treatment resources. And that would be 1-800-327-5050. And as mentioned, we are going to be listing all of this information at the end of this. Marijuana Anonymous and Smart Recovery also have virtual peer recovery meetings that are for teens available online right now. And there are also even apps for your phone that teens can download in order to get help with quitting vaping, especially. Therapy also continues to remain a really good option this time with telehealth sessions. For parents, please contact your child's primary care provider for potential referral information, or you can also go to the Psychology Today website to check out information about providers who are in your area who take your insurance. So in closing, we really just want to remind people at the end of the day that what we're experiencing right now is not a normal situation. And this may be one of the worst global healthcare crises of our lifetimes. So if you're feeling overwhelmed, stressed, angry, or afraid, as Sarah mentioned, that's a very normal response to the trauma that we're experiencing right now. However, we also don't want anyone to feel as though that needs to continue to be their so-called new normal. So more than ever, self-care and taking care of your health is so important for all of us. Please reach out to others, get the support and resources that you need right now. And just remember, again, we are stronger together than we are apart. And just wanted to say again, thank you for listening today. Please be safe, take care, and please do feel free to reach out to Sarah or I if you have any other questions that we can help you with.
Thank you.